Baseball. I should have a baseball cap.
Good evening, everybody. You are all really welcome to 2026. Happy New Year to you all. We're delighted to have Tim here. I'm just admiring his really American looking top there, O'Hare University. Looking suave there, Tim.
Thank you very much. Back at you, Siobhan.
Yeah, so any plans for 2026?
Oh yeah, loads. Um, Top of the list. I'm going to Nova Scotia. I'm really looking
Oh,
forward to that. A couple of holidays in Cyprus. I go to Cyprus every year. I used to live
you
there.
love it, don't you? Yeah.
Yeah, yeah, that's my happy place.
Is that your happy place?
Yeah.
Yeah.
Yeah, we've
Oh,
also
it
got a
is.
static caravan. Sorry, we got a static caravan that we had in Norfolk on the beach, and we go there a lot. So yeah, I'm up there a lot in the
Lovely.
summer.
I absolutely love the sea and water just for the chill out. I
No,
am
no,
unable to hear you. Could somebody else let me know if you can't hear us for any reason? And Barbara, you may need to just go out and come back in. Could somebody just put in the chat if they can hear us? Yeah,
yeah,
you can
let me
hear
know.
us both. Yes. So, Barbara, you may just have to go out and come back in.
Notice when you
You're,
asked me that question, I replied in all holiday sort of stuff. I didn't discuss anything professional. That's how my mind works now.
yeah, I get that, especially in January. Yeah. You're very
Oh dear.
welcome, everybody. I know everybody is still coming in, and we're just saying Happy New Year to you and discussing what were goals. And our goals seem to be lots of holidays and breaks, Tim, this year. We are delighted to have Tim Ives here this evening. He's a writer, teacher, a researcher, speaker. He's the co founder of O'Hare University. He puts his head above the parapet. He will be my go to ask for advice and questions. He's fabulous. He has an interest in sugar, and honestly, the last few lectures of yours, Tim, it's really like life changing, actually, to the information that you're giving out. So you're in for a real treat this evening. He's gone above and beyond to put in a little poll for you all that
Oh
isn't the
yeah.
most straightforward, just to remind you of that. So, just to let you know that there'll be a QR code at the end of the presentation. So, you can scan the QR code, answer the CPD questions, and your CPD certificate will be emailed to you. I'll also put a link in that you can click into on your laptop to answer those questions. So, that will be at the end. If you happen that you have to leave the presentation, you can watch this presentation online in 7 to 10 days, and that way you can get your CPD certificate. So, with that, any questions and answers, please put in the Q&A and chat, say yes or no, or any questions that Tim's going to ask you here. And yeah, I'm going to hand it straight over. Thanks very much, Tim.
Thank you very much, Siobhan. That was a really nice introduction. Can I live up to it? That is the question. So to begin with, I've just put up a poll, four questions. I'll give you a few more seconds. First one, how would you rate the role of exercise in weight management? 1 to 10. Second one, how significant is sugar intake in shaping weight outcomes? And third one, how is dietary unsaturated fat correlated to cardiovascular disease risk? And the fourth one, assuming someone with 28 teeth, which one is the most important to prevent gingival inflammation? Effective toothbrushing, effective interdental cleaning, or a low sugar diet? Um, can you still see that on there, Siobhan?
Yes, I can. Yeah,
Cool.
and it's working. Everybody's filling it in.
Yeah, it's quite interesting, the answers as well.
Yeah.
Which one out of those? I mean, on number four, I don't know what I would put. out of effective toothbrushing or effective interdental cleaning? I don't know what the answer is to that one, to be really honest, out of those two. It's a tricky one, isn't it?
I would go for incidental cleaning
Yeah, maybe.
because 40% of the bacteria is left behind after brushing.
Yeah,
So your tongue, nits, and saliva can probably
yeah.
wash a lot, but that 40% is hard to get at. That would be my
And
take on it.
the vast majority of the vast majority of gum disease is incidental, isn't it?
And decay starts there.
Yeah.
And yeah.
Somebody just said they can only see the first question.
Oh,
Everybody else
well,
has answered loads of questions.
you just need to move it up and down with your cursor if you're on the laptop, and then I presume on a phone you just scroll down.
Yeah, you need that very, very well observed.
Is that okay, Catherine? So the phone, just scroll, and if you're on a laptop, you can just put it on the cursor and scroll down.
So, Siobhan, are you going to be able to keep an eye on questions and things for me?
Yes, I will do all of that.
Cool,
Yeah.
thanks. So I'm gonna give it another 10 seconds and then I'll stop the poll. Brill. Thank you.
Do you have sound for this presentation?
No,
You
I
don't
don't.
have your music, no?
Don't think so.
Just when you go into the green button share, there's a little right-hand corner, it'll say share sound. Just click that just in case.
Oh, okay, I'll press it anyway. Ba, 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 ba. So let's see. So I hope you can all see that okay.
Yes, we can.
Brill. So we are conducting a vast, uncontrolled experiment on the human body by eating industrially processed food. Have that in the back of your mind throughout the next hour. Who's controlling what you're eating? Ooh. So this is funny. We were talking earlier, Siobhan,
Yeah.
about Jaws. This is Brighton Beach in the 1970s, and just have a look around and just see how many overweight, stroke, obese people you can see. And have a think about what Brighton Beach would look like in 2025, 26. I reckon it'll look a lot different to that. So the big question is why? Why have people grown so big over the last 50 years? So this is what we're going to be talking about. Unsweetening the truth, physical, mental, and oral health, your Christmas comeback. I've got to start by telling everybody that I am not coming at you as a big I am. I'm coming at you as somebody who's completely and utterly addicted to sugar. And I have been for a really long time. And like many addicted people, I struggle with it. And I failed miserably over Christmas. And I'm now back on the wagon. I've been so for a few days. And I know there's people on this today that have actually stopped eating sugar on the 1st of January. So kudos to you and keep on going. It is not easy. And do not blame yourself if you quit and if you stop, go back to eating sugar. It's a thing that takes a long time. So, aims and outcomes. So, the aim is to debunk common myths linking exercise, fat restriction, and weight loss while empowering participants to improve physical, mental, and oral health through better understanding of sugar, ultra-processed foods, and sustainable behavior change. By the end of this presentation, you should be able to identify at least 3 ways sugar and ultra-processed foods affect physical, mental, and oral health, Explain why increased exercise alone is not an effective or reliable strategy for weight loss. Describe the evidence on dietary fat and weight management, including why reducing fat is not always associated with long-term weight loss. Commit to one personalized evidence-based behavior change strategy that supports improved total health. I hope that is okay for you. So this first graph isn't an accurate graph. It's just a pretty picture. It doesn't show you exactly how the line has gone, but it is a much steeper curve than that. So what's it showing us is the amount of increase in sugar people are consuming over the years. So starting in 1704, people were consuming about a teaspoon a day on average, and in 2021 people were consuming about 31 teaspoons per day on average. So an enormous jump in consumption of sugar. And something really big happened in 1955. Although you can't see it on the graph, it actually shot up from 1955 and it's still going up quite radically at the moment. I'm going to explain very briefly what happened in 1955. This study was published by a man called Ansel Keys, who was a famous nutritionist in the United States. And he was convinced, based on no evidence whatsoever, that fat was the cause of heart disease, especially in middle-aged men. At the time, there was a lot of middle-aged men that were dropping dead in their 50s. And so he came up with this hypothesis that it was fat that was the problem. And he published this graph, which is really convincing. You can see the deaths per thousand on the vertical axis, and then the amount of fat consumed as a percentage total on the horizontal axis. That there's pretty much a straight line going from Japan, Italy, and up through Australia, Canada, USA. So what it's telling us is the more fat you had in your diet, the more likelihood you were to die of heart disease. The only problem is that he lied, because this is the real graph. So what he did is he took the data that he liked from the 22 country study and he created the 7 country study. And you can see the real data is all over the place. So you can see that like number 14, a country like Mexico that was consuming a lot of fat had very low deaths through heart disease. And there's quite a few others as well. 15, Netherlands, very low incidence, very low fat, very low incidence, high fat, sorry, low incidence of heart disease. Now, at the same time, we knew that sugar was the cause of heart disease because a guy called John Yudkin, who was a professor in London, was the first author of this book, Pure, White, and Deadly. It was the first book that was written about sugar and its relationship to health. And he just simply identified that sucrose consists of 2 molecules, glucose and fructose, 50-50. Glucose is used as an energy source. Fructose is converted to fat. So for every teaspoon of sugar that you consume, half of it gets converted to fat. But this information didn't really get out because it was fought by Ansel Keys and his fat hypothesis. And so Yudkin lost the argument because he was just a normal professor, whereas Keys was a very charismatic nutritionist and he had the backing of the sugar industry. And so they blew Yudkin out the water. Unfortunately, he would die before he saw the truth come out. So what happened as a result is we had the low-fat diet. And I was a child in the 70s and 80s. I know I don't look it. And I can remember all those things really well. Steak, really good Irish butter, lots of scrambled eggs for breakfast, and I used to drink gallons of milk. But after when the low-fat diet was born, we stopped eating so much meat and we started to eat a lot more pasta. We stopped eating butter and we started to eat garbage. And we stopped eating healthy scrambled eggs and we started to eat ultra-processed breakfast cereals. And we stopped drinking milk and we started to drink sugary Sunny Delight orange juice, the drink that makes you go orange. So, essentially, cutting fat increases weight and disease risk because most people and food companies replace the fat with refined carbs and ultra-processed foods, which increase hunger and total calorie intake. So, what does the evidence tell us? What's more linked to metabolic disease? Well, it's added sugars. There's strong epidemiological evidence and strong mechanistic evidence and strong experimental evidence and very weak evidence for dietary fats. Um, so historically, food availability data demonstrate an order of magnitude increase in sugar consumption over the past 2 centuries, far exceeding changes in fat intake. Epidemiological, mechanistic, and experimental evidence consistently links added sugars, particularly within ultra-processed food matrices, to metabolic disease risk more strongly than dietary fat. Feel free to take photographs of the research evidence that I'm putting up. I've selected the papers that really are quite well known. So, in the Lancet, in 29th of August 2017, they published this study. It was an enormous study. It looked at 18 countries from 5 continents, involving thousands of people. And essentially, the findings are that a high carbohydrate diet was associated with higher risk of total mortality, whereas total fat and individual types of fat were related to lower total mortality. Total fat and types of fat were not associated with cardiovascular disease, myocardial infarction, or cardiovascular disease mortality. Global dietary guidelines should be reconsidered in light of these findings. And have you noticed if guidelines have changed considerably? So it's telling us, this paper is telling us that carbohydrates are responsible for high levels of cardiovascular disease, and fats make very little difference. But but um, this is another huge study. So it's a systematic review and a meta-analysis of randomized controlled trials that looked at fats in your diet. And what happens if you increase polyunsaturated fat in your diet? The answer is replacing, that should be unsaturated fat, sorry. Sorry, yeah, replacing saturated fat with polyunsaturated fat reduces coronary heart disease events by 19%. That's an enormous figure. So you should be drinking olive oil. Um, if you if you have or anybody in your family has a heart disease risk, loads and loads of olive oil and loads of avocado oil, um, because these oils are really, really healthy for you. So what does this graph shows us? Well, it shows us that in 1950, obesity wasn't a thing, and there was very few overweight people in UK. And if you look at 1980, so 30 years later, you can see that obesity suddenly appeared, and the overweight healthy division is almost kind of 50-50. And then jumping forward 40 years to 2020, we can see that we've now got another category called severely obese. So we have severely obese, obese, and overweight, and now though those numbers are hugely bigger than the amount of healthy weight people. So my question to you is, what do you think this number is going to be like in 2050? Will there be anybody left who is of a normal weight? And one of the major reasons is the marketing of foods, or as I prefer to call them, food-like products. And because the vast amount of money is spent on food that is unhealthy, and mostly it's ultra-processed foods. And you can see that healthy foods probably amount to less than a quarter. So the question that you should be asking yourself is, why is this? Why do companies feel the need to market ultra-processed foods? So what do what do sugar producers want you to believe? Have a think. What is it that what messages do they want to send you through their marketing? What have you seen on adverts? And this is really important because you need to know your enemy. And your enemy is a donut or an ice cream or a milkshake. So natural and harmless. It comes from a plant. It can't be unhealthy. It's a source of energy and happiness. Sugar is not just food, it's emotional well-being. It's not responsible for obesity, diabetes, or heart disease. Disease comes from everything except sugar. It's fine in moderation, undefined. You don't need less sugar, you just need better willpower. Better than sugar alternatives. Only real sugar delivers real pleasure. A normal part of the balanced diet. Sugar is normal, it's necessary and expected. Only a problem if you don't exercise enough. You can burn off sugar if you try hard enough. So they're the messages that the companies are spending zillions of pounds trying to make you believe. So with all that, will exercise help with weight management? So have a think. Have you joined a gymnasium in January with a view to losing weight? Have you started a new exercise regime, determined to lose the weight that you put on at Christmas? Have you started running? There's a lot of really good reasons to start exercising. A lot of good reasons. But is weight management a realistic one? Let's have a look at the evidence. So this is quite a famous study, and I would say that there's a lot of similar studies that have been done looking at the amount of calories different groups burn up in a day. And this study looked at hunter-gatherers from Africa and your typical urban dwelling Americans. And have a think, which one do you think burns up the most calories in a day? Well, the answer is they burn the same number of calories per day. I'll just let you take that in a little bit. So there's people running around Tanzania, and there's people sitting at their desks in America, and they're both burning the same amount of calories. Why do you think that is? Have a think to yourself. Why could that possibly be? Well, it's called the constrained energy model. So humans burn about the same total calories each day because the body balances its energy use. So when physical activity goes up, it reduces energy spent on the other internal processes. So think of it like a bank account with a fixed spending limit. If you spend more than one thing, for example, running or movement, your body spends less on other things like dealing with inflammation, stress responses, digestion, immune activity. reproductive activity, etc. So, what all of these studies tell us is that whatever you're doing throughout the day, the chances are at the end of the day, you're going to burn the same amount of calories as somebody else. So the evidence is telling us, and there are, I'll repeat, there are several other studies that have the same results. You can't outrun a bad diet, and you definitely can't outrun an ultra processed ice cream with loaded sugar. So let's have a look at making sense of processed foods. So Carlos Monteiro is a Brazilian professor, and he's done loads of research on ultra processed foods, probably more than anybody else in the world. And he developed a really easy way to understand ultra processed foods. He developed something called the Nova categorization system. And that's again a link. Well, not a link. It's the reference for the paper. Again, if you want to take a photo of it, it's definitely worth checking out. Um, and he created four groups. So one, two, three, and four. In group one, they are unprocessed or minimally processed food. Example, a steak. All you do is you fry it or grill it or whatever. And number two is processed culinary ingredients. So this includes things like butter, sugar, and honey. They're extracted by processes such as pressing, grinding, crushing, pulverizing, refining. Although not always healthy, they are used very sparingly. So if you look at the example, it's a tiny little bit on top of the salmon. So I think you would all agree that that's a pretty healthy meal. And number three is group three is processed foods. So these contain elements from groups one and two, processed by manufacturers, often salted, fermented, or pickled. And they include bacon, cheeses, canned fruit and vegetables, smoked salmon, and traditionally made bread. And now we get on to group four, the ultra processed foods. Now, these are things that you usually wouldn't have in your kitchen. Now, before I go on with the rest of it, that is a fantastic way to describe ultra processed food to your patients. If it contains something that is not in your kitchen cabinet at home, then it's an ultra processed food. So that's things like colorings, emulsifiers, flavorings, and other additives to make the product look better and increase the shelf life, and to make you want to eat more. Foods in this group include most shop-bought biscuits and cakes, mass-produced breads, reconstituted meat products, mass-produced desserts, and many ready meals. So that's something one of the key things that I would take away with you today is that first line. An ultra processed food is something that contains an ingredient that's not in your kitchen cabinet. So based on this Nova classification, 50% of UK household food purchases are ultra processed. So 50% of what we're eating is ultra processed. Germany 46%, 14 in percent in France, and 13% in Italy. So they're eating way less than we are in UK. So an incremental 10% increase in the proportion of ultra processed foods in a person's diet is correlated with a 12% increase in cancer, 21% increase in depressive symptoms like anxiety, and a 12% increase in cardiovascular disease. So I've put the three references there again if you want to look into a bit more detail if any of those issues are of interest to you: cancer, depression, cardiovascular disease, and their relationship to ultra processed foods. So, what do processed food companies want you to believe? So, just to let you think about that for a little bit. What do you think they want you to believe? So UPFs are convenient solutions for busy lives. Healthy eating is unrealistic. UPFs are practical and modern. They are nutritious because they're fortified. UPFs aren't just harmless, they're actively good for you. They're highly palatable foods, which equals happiness, comfort, and reward. Joy comes from eating our products. Health problems come from lifestyle, not food. The product isn't the issue, it's your behavior. New, better for you versions are healthy. UPFs can be upgraded into healthy foods. They support modern families. UPFs help you be a better parent. Choice equals freedom. So UPFs are empowering. So did you spot the difference in the marketing strategies for ultra processed foods and sugar? So sugar manufacturers want you to believe sugar is natural, harmless, energizing, part of a balanced lifestyle, unfairly blamed. Do you believe that? And UPF manufacturers want you to believe UPFs are convenient, nutritious, because they're fortified, solutions to modern life, emotionally comforting, health optimized versions of real food. Do you believe that? So, this is how ultra processed food companies want you to frame foods. So, they want you to refer to protein. They don't want you to call it a steak. And they want you to call butter fat. And they want to refer you to carbs rather than pasta or bread. So, one of the leading people in the world on ultra processed food is Marianne Nestle. And she's written a really interesting book about it. She says corporations have a vested interest in keeping the public focused on single nutrients rather than their products as a whole. So they want you to use micronutrient terminology because they can't make a steak. They can't produce an apple. So they don't want you to talk about stuff like that. They want you to break it down because that's their language, and they want you to keep using that language. So my advice and my guidance is when you're talking to your patients, don't break things down into micronutrients. Talk about them in terms of real food. So another really fascinating study. This cost a lot of money. They did an inpatient randomized control trial in a hospital. Um, so they put a group of people on 2 weeks of ultra processed foods, so packaged meals, processed breads, sweetened yogurts, ready to eat foods, and then they put them on 2 weeks of unprocessed whole foods, so fruit, vegetables, meat, eggs, nuts, simple home style meals. Both diets were matched for calories, sugar, fat, carbs, fiber, and salt. The only difference was the degree of processing. And they were told, eat as much or little as you want. So, what do you think happened? Have a think to yourself. What do you think the results were? They could eat whatever they want, 2 weeks of ultra processed, 2 weeks of unprocessed, but both diets contained the same calories, sugar, fat, carbs, fiber, and salt. So the result was people on the ultra processed foods ate about 500 calories a day more and gained weight in just 2 weeks. And then when they went onto the whole food diet, they lost weight without trying. So this was groundbreaking research because it informs us that ultra processed foods cause overeating, even when sugar and calories are identical. So something that's ultra processed that has sugar in it, you're far more likely to eat more of it if it's ultra processed. So here's here's some handy hints that I've put together that I think might help you when you're talking to your patients. So shift the language. Talk in terms of whole foods, not nutrients. This is a really useful question. What real foods are you eating most often? Give them time to answer that because it's going to take them a while to consider um, the answer. Before buying anything in a packet, take 5 seconds to read the ingredient list. If there are things you don't recognize or the list is long, put it back. Swap, don't stop. So suggest one realistic ultra processed food for a whole food replacement. Help identify sneaky sugars on UPFs with one simple rule. If the ingredient list is longer than 3 items or includes things you don't have in your store cupboard, it's a UPF. Put it back. So here's my clinician's super tool. Shift the blame. This isn't your fault. These foods are designed to make you overeat. Your biology is working exactly as expected. It's not your fault. There is no blame culture here. This is purely the fault of sugar manufacturers, ultra processed food manufacturers, and bad governments. So I'll just come out of that just for a sec, just to see if there's any questions at this point.
If you want to put any questions into the Q&A, or you can wait at the end, but if you have any at the moment for Tim.
I think that's a no.
I think that's a no for now, but they will
Cool.
definitely ask at the end anyway.
How am I doing, Siobhan? All right.
Fantastic. Yeah.
Real. So, Chris Van Dulican, if you haven't read all the ultra processed people, I urge you to read that book. So we are the first humans in history whose diets are dominated by substances invented by industry, not shaped by evolution. So I've got the World Health Organization guidelines for maximum recommended daily amount of sugar. So these are worked out by the WHO. They consider that they say that 5% of your diet should be sugar. Well, no more than 5% of your diet should be sugar. And they then look at the amount of calories that a child, an adult would eat, and then they've worked out this figure from that. And so an adult is 25 grams, a child is 22 grams, and children up to the age 6 is 20 grams. The NHS guidelines are slightly different, but wherever you are in the world, you cannot go wrong if you follow the WHO guidelines. So, in the interests of research, I brought myself a packet of Kellogg's Frosties, and it says on the pack that there's 37 grams of sugar per 100 grams. Now, I poured a bowl out that I would consider normal that I would eat if I were going to eat this rubbish, and I think you'd probably agree that that's about normal. And oops. So 50 grams of Frosties equals 18.5 grams of sugar. That's 5 teaspoons. So with that one bowl of Kellogg's Frosties, you're pretty much not far off um, your maximum daily intake of sugar for a day. So if you have children, I would think about that seriously. So I've put together a petition that looks at mandating the amount of sugar that companies are allowed to put into a single serving food item. And I don't think it should be more than the recommended maximum intake of sugar per day. I would love for you to sign the petition if you can. You can take a photo of that or use your camera, and that would be brilliant. I'd really appreciate if you could do that. If you disagree, obviously don't do it. So let's talk about sugar and inflammation for a little bit. That's a human cell. those little things that look like insects are the mitochondria. And the mitochondria, as you know, is the powerhouse. It acts like a battery, and it gives off energy, stores energy. And it works by taking in glucose and oxygen. And every time it does that, it pushes out a free radical. So I would say that this is a typical healthy meal. So if you've eaten something like that, you're going to get this response where you take in the glucose and oxygen, and your body just pushes out a few free radicals. But because the meal was so healthy, it has loads of antioxidants. So an antioxidant, an example is vitamin A or vitamin C, and these are really clever because free radicals are dangerous because they have lost an electron and they go foraging around your body trying to find an electron, and that causes complete havoc in your cells. And antioxidants are really clever because they carry spare electrons. So they can corner these free radicals and they can dish one of their electrons to the free radical, rendering it completely harmless. So if you've had a really healthy meal, you have nothing to worry about because you have loads of antioxidants to deal with your free radicals. Now, if your meal looked like this, there's a very good chance you're going to have a massive excess of free radicals knocking around your body, more than the antioxidants will be able to deal with. Now, we call that oxidative stress. So, a good definition is it's a condition resulting from an imbalance between the production of free radicals and the body's ability to neutralize them with antioxidants. Now, thing is, oxidative stress causes inflammation. Now I don't understand this science. I've got to be really honest with you. It's really complex. So I've kind of broken it down, not for you, but for me to understand. So oxidative stress triggers inflammation because the free radicals damage cells and the body responds by sending in the immune system to clean up the mess. Now, when that happens, you get more oxidative stress because inflammation creates more immune cells releasing free radicals to fight the damage. So they add even more free radicals into the system, which then creates chronic inflammation. So chronic inflammation is where immune cells keep releasing free radicals, even when there's no threat, which leads to ongoing tissue damage and more oxidative stress. So when the body gets bombarded so often, the immune system forgets how to stand down and it's constantly on alert. So if you're unsure what chronic inflammation looks like, this is what chronic inflammation looks like. You may have seen it before. So chronic inflammation can be stopped by removing the things that keep irritating the body. The most common five things talked about are ultra processed foods, sugar, smoking, alcohol, and chronic stress. So, what happens to our gums when we stop consuming added sugar and start eating like our ancestors? So, this is a really famous study in the Journal of Periodontology by Baumgartner. And he took participants and he didn't let them brush their teeth or use interdental cleaning. So, there's no oral hygiene for 4 weeks. And at the same time, they went on a very primitive diet. So no ultra processed foods, no sugar. Excuse me. So a Stone Age diet. Have a think what you think might have happened during that diet. So biofilm levels increased. Bleeding reduced from 35 to 12%. And probing depth reduced. No brushing, no flossing. Healthy diet. Things got healthy. So the conclusion was that subgingival bacterial counts increased for several species not linked to periodontitis. So what happened is the biofilm levels went up, but they became less pathogenic. So bacteria moved in that was healthy. Interesting. That's the solution. paleo diet. Excuse me. But this is the thing, you see. I should imagine that quite a few of you watching this will see that and think that resembles probably your practice staff room. I've been in many practice staff rooms and I've seen a lot of that. And I've got to admit, hands up, I contributed to lots of this myself. I did a piece of research that looked at um, what happens when we ask hygienists and therapists to try stop eating sugar for 28 days. And it was published in Dental Health in 2021 in the Annual Clinical Journal. So 41% completed the 28 days. I think that's really good. And 59% failed in inverted commas to complete 28 days. When I say failed, they learned so much from this that it was great. So some important food discoveries. Things where you don't think sugar's going to crop up does crop up. So read the ingredients. Things like OXO cubes, processed meats, gluten-free products, and vegetarian products are quite commonly very high in sugar. Xylitol was a real winner in that a lot of people successfully switched from sugar to xylitol. There's only two sweeteners that I'd recommend. One xylitol, the other is erythritol. They're backed by loads and loads of research and are a really good substitute for your patients. Every summer I make xylitol and strawberry jam. So, yeah, just a little bit of information. It occurs naturally. Strawberries, cauliflowers, pumpkins have got lots of xylitol and similar sweetness to sugar, but 40% of the calories. Extremely safe for humans because we metabolize it in the liver. Erythritol is probably even slightly better because it's less laxative. And the combination of the two are really good together. And xylitol also has a positive effect on the gut microbiome. So these are things that people identified when they were going through the 28 days. They identified number one, they were addicted to sugar. Some didn't realize they were addicted, and that was with the reason that they failed. A lot of people noticed that when they stopped eating sugar, they had less anxiety. We had a few people that suffered anxiety, and they noticed it was hugely less. Excuse me. A lot of people with inflammatory problems were noticing less joint pain, and people were also losing weight. And we had a couple of teachers, and they said we really need to change the curriculum to include ultra processed foods and sugar. One of the questions that was asked a lot was, what is a treat? How do we define a treat? Because nowadays people are eating so much stuff that are they treats anymore? And people were changing the way that they talk to their patients based on what they were discovering. And this list of 75 different names for sugar, I would urge you to take a photograph. And I'm pretty sure that you would probably know most of them. There might be some on there that you don't recognize, but the sugar industry are constantly inventing new words to confuse the consumer. Because we ask people to read ingredient lists, but do they understand the ingredient list? Did you know that dietase is another name for sugar? If you can let your patients have this information, that would be brilliant. So people that plan their meals are much more likely to succeed. Excuse me. People who drink alcohol are less likely to succeed. There were people who had family at home that knew that they were trying to quit sugar, but they still offered them sugar. I thought that was quite interesting. There's probably a whole PhD research project somewhere for somebody. And people who formed their own little mini groups were more likely to succeed. There was one particular group that started on Facebook that was a support group for people doing this, and they were far more likely to succeed. And that got me thinking, after this particular piece of research. Excuse me. If anybody does public speaking, this stuff is great orally. If you get a tickly throat or your mouth dries up when you're talking. Um, so I went away and I researched it a bit. And there's an enormous book published by Joan Ifland called Processed Food Addiction. And she considers that ancient tribes, the power of being in a tribe was huge. And the biggest fear of somebody was to get kicked out of that group because it meant that they probably wouldn't survive. And that has stayed in our brains right up until this century. And she believes that that fear of getting kicked out of a tribe trumps addiction. And so that kind of gave me the idea for my next piece of research was to create a tribe for 3 months. And this was really successful. People who are in this group um, really wanted to succeed because they were making up their own rules and they were defying certain things, discussing, helping people, supporting them, pretty much like a tribe would. And within that group, 15 lost weight with an average weight loss of 4.5 kilos. Four participants remained the same weight, and one participant gained weight. I have to say that one participant was pregnant. Seven participants reported they were happier, with an increase of 20%. Seven reported they were as happy, and one participant reported they were unhappier. Guess who that was? So, addiction. Again, they really understood the power of being addicted. The more you consume sugar or UPFs, the more you will consume. So you might start off with eating one small amount, and then over the days that gets more and more and more and more. It behaves just like a drug on your brain, in that the same you need more to get the same hit. Again, they really noticed an improvement in their mental health. Um, and yeah, as I said, they were noticing if you didn't quit, they really understood that for some personalities, they had to stay completely quit. Some were okay, like some could dabble and they wouldn't put on too much increase in their sugar consumption. And I just put this here. This has got nothing to do with the research that I did, but something that the World Health Organization are really worried about at the moment is the addiction of sugar in babies, because we're feeding them way too much sugar at an early age, and it's hugely impacting the development of their brain. And there's lots of new research coming out about this particular topic at the moment. So really pass this on to your patients. And if you have very young ones yourself, be very wary about what you're feeding them. Read everything, and ideally just give them whole foods. Tribal behavior, people who were in the tribe were much less likely to make unhealthy decisions. My tribe doesn't eat that. They really appreciated the ability to be able to talk as a group, and to discuss their issues with addiction of processed foods and sugar. It was very powerful. Um, Whereas in the previous group, people were more likely to give in to family members that were offering them stuff. In this group, they were far less likely to do that because they had this kind of thought processes that they were in a tribe and they're not going to do that. And at the end of it, they didn't want to leave. So we've kept it going. And so if anybody's interested, you can still you can join. There's over 200 hygienists in there now. So just drop me a line and I'll add you. In fact, you'll have to send me a friend thing on Facebook. So we looked at what happened a year later to these people after they finish the research. So we revisited it. And 50% remained sugar-free, 50% let sugar creep back in. The sugar-free clinicians remained mentally and physically healthy, and the sugar consumers noticed their health had deteriorated. I let sugar gradually creep back into my diet, so that's been a big change. Physically, I gained weight and stopped exercising as much as my energy levels dropped. Mentally, that has had an impact. The thought of eliminating sugar again feels daunting without being part of the research group and having the momentum of a tribe all pushing forwards together. I now approach these conversations entirely differently and I'm better placed to support them. I have independently sourced details of other healthcare professionals in the area around where I work, so I start conversations now knowing I have the resources to refer on. So what this tells us is that if you want to successfully help your patients quit sugar, quit an addiction, the best way to go about it is to develop groups. Now, I don't know how you would do that, but I'm pretty sure it is possible in most practices to create some sort of group for your patients to help each other. It's worth considering. So, in conclusion, um, sugar and UPFs are directly related to heart disease, obesity, diabetes, cancer, caries, periodontal disease, and other inflammatory diseases. Sugar and UPFs are highly addictive. Sugar and UPF availability and consumption is increasing. Quitting sugar and UPFs is an extremely complex process and should be treated like any other addiction. I would urge you to have a go yourself at stopping sugar and UPFs and just to see what you can learn through the process. I'm pretty sure you would definitely learn something that you could pass on to your patients. So, Marion Nestle again. Much of what we eat today has never been tested for long-term safety. We are learning the consequences in real time. So I hopefully succeeded with those aims and outcomes. That's my contact website and social media details. I'll just give you a second. Oh, look at that timing. Give you a second to scan that if you want. And finally, NSK are kindly giving you 40% off their products. That's really generous.
That's only for education and for this audience, yeah.
Cool. Brilliant. I'll leave that there so people can.
And yeah, thank you so much, Tim. And on the right-hand side is the QR code that you can scan, take a picture of it, and then press into it. Or I'm going to just put the link in here as well that you can go to answer the questions. Are you going to do the poll now or come
Yes,
back to it in a minute?
I'll
We'll
stop
just give that
sharing.
they just need that for this, the QR. Are you going to
Let
go
me go
back to
back
that in a
onto it.
second? Yeah, okay.
Do you want me to go back on now?
Maybe just go back for a minute and give people a chance to do that. It just takes a few minutes. It can just get very busy. It's busy this evening. So one of your patients is here this evening, actually, Tim.
Really?
I'm going to bring him in there. Are you there, Gray? I'm promoting you to a panelist.
Oh, yeah. Hi, Graham. You're
He doesn't
muted.
turn up. He only turned up for you.
Shall I stop the sharing?
Have you all managed to do the QR code for that or follow the link in the chat? Petition signed, anyway.
I'll stop sharing, put the poll up, and I
Stop
can put it
sharing,
up
and
again if you want.
we can put this back up when you go to questions. Yeah. Okay.
Hi, Graham. How you doing?
I'm very well, thanks, Tim. Yourself?
Yeah, I'm good, thank you.
He's come along to hear what you're telling people now.
No, he's always preach this, and quite rightly too. Yeah.
Thanks for coming on, Graham. We're just
My
going to have a
pleasure.
look at the poll, see what people said and what they think now. So you're going to put that up for you to see.
Can you see it?
Not yet.
It's not letting me launch it. The results is being shared. Oh, let me just go back. How things I stop sharing. Share results. That was the first one.
Yeah, we can see it now. So do you want to try answering that again now after what you've heard?
So let's have a quick look at this. Oh, most of you thought unsaturated fat increased risk. Interesting. Review. Launch. So, should be able to see that now. Please answer the same questions.
Are you able to compare them then side by side or not? You'll kind of
Um,
know anyway.
yeah, I'm going to know.
So in the chat, Olivia's just mentioned about the fish farms and about what's been fed the fish, and particularly one of the pink dyes that's been put into the salmon.
Oh, yeah, I know.
Yeah.
What do you think about the addition of folic acid to bread? Oh, great question. Honestly, Susan, I've never really thought about it. But essentially, if you buy bread, I mean, this is really difficult because a lot of people can't afford to buy bread from a really good bakery every day. But there should only be flour, salt. If you buy sourdough, you don't even need sugar.
I always buy sourdough. I read that book Not on the Label years ago, and it really changed how I shop and everything and look at everything. I'm from Canada, and the government wants to make pretend meat and milk without the public permission. How can we citizens tell them, hell no, this is not good?
These are rhetorical questions, aren't they? How would you rate them?
Like an American theme this evening, isn't it? A Canada
How would
theme.
you rate the role of exercising women? Oh, there's a lot more different answers there now.
Okay. Which food guide do you recommend as a diagram to give to patients?
Well, I'm not a fan of Donald Trump, but the one they've just brought out in America is very close to what I would recommend.
Yeah.
So it's actually the upside down pyramid, the one that the NHS are recommending.
So have you got your answers there now, and how do they compare?
Well, the last question for 75% are now saying a low sugar diet would be the most important thing
Yeah.
to prevent gingival inflammation, which is quite interesting. I don't know the answer to that question, by the way. It's one that I just made up. But I'm pleased that you're now seeing that there's a big relationship between sugar and gingival inflammation. My gut instinct is that toothbrushing and sugar are probably very similar. All three, I'd say, are probably equally as important. How is dietary unsaturated fat correlated to cardiovascular disease? Well, the correct answer, it doesn't affect cardiovascular disease risk. Sorry, it decreases risk. So the more olive oil that you consume in your diet compared to other fats decreases your risk. Um, How significant is sugar intake in shaping weight? Yeah, 10. I would give it a 10, and which is 77%. How would you rate the role of exercise in weight management? And there's a real scattering of answers there now, um, with the most common answer 5. Interesting. Definitely changed quite considerably from the first 4 to the last 4. Thank you for that. I shall end that poll and share the results so you can have a look. Have we got any other questions?
Any more questions there?
Oh, I can see the chat now.
I don't know whether it's what I look at on social media and the algorithms and so on, but there's definitely been a shift in the last few weeks, hasn't there? And there's a lot more influencers going in and looking at labels. I particularly, my husband started this a few months ago, having a look at the amount of chocolate in bars and biscuits and things like that. Did you know in a penguin there's absolutely no chocolate at all?
Yeah, the law in UK is different to Europe. They can't call in Europe, you can't call something chocolate if it hasn't got a certain amount of cocoa mass in it. Yeah, there's
They
a lot of
didn't have
products.
any in the penguins.
No, that's a
Okay.
confectionery. It's just sugar and rubbish and ultra processed food
Sugar,
garbage.
yeah.
I would put out a plea to everybody, actually. Um, oh, yes, James Gornick book is very good. I'd recommend that as well. I'd start with ultra processed people, though, if you want to be really shocked. Yeah, Nestle. Do not buy anything made by Nestle.
No, I never do.
The people
Never.
that make Kit Kats, they are an evil company, and they're responsible for thousands of deaths of people every year. Please don't buy anything made by Nestle.
Tell about the ships going down in the
Oh
Amazon,
yeah.
Tim.
Well, they built this enormous ship and filled it full of ultra processed garbage, and they sailed it down the Amazon River, and they gave it to all the various tribes that were consuming a diet of shrimps and healthy vegetables and stuff that they were growing and fish. And within a few years, they went from being one of the healthiest populations on the planet to the population with the biggest growing diabetes risk in the world. They converted them in a couple of years to from being really healthy to diabetics. It's crazy.
Mm.
So yeah, they're just they're all they want to do is they want to make money for their shareholders, and they want to get you eating as much of it as you possibly can and get addicted to it as much as you can. And it's really difficult. So yes, definitely don't blame your patients. It's the companies. It's their fault. Just looking through this. Cool.
I've just put in the code as well back in there for the NSK code for the shop. And did everybody get the link is back there? And did you all get to do the link to do the questions to get your CPD?
Do you want me
Is
to
there
put it
anybody
back?
saying no? I think definitely for me, practice as a dental hygienist over 20 years, I knew there was more, and I tell this story. That's why I went back to study, and that's why I created the diploma in oral and positive health, which is a combination of lifestyle medicine and positive psychology, to really look at the inflammation and the sugar and all, and the lifestyle factors around all of this, that it wasn't just toothbrushing, because I had done every single course under the sun to do with instrumentation. And of course, I do a lot of training in that area, but it became quite apparent that there was a lot more going on. And I think at undergraduate level, they really need to start looking at this a lot more. I'll
Yes.
just put the
I
diploma there
if I
just in
had my
case.
way, I'd completely change the curriculum. So we had a big focus on nutrition, big focus on breathing, oral myology, and a massive focus throughout the whole course on behavior change, like a running theme throughout the whole of dental hygiene and dental therapy. How can you get
And
people to change their
dentists.
behavior? Yeah, and dentists. Yeah.
definitely. Well, Tim, that was very enjoyable. Of course, you bring something different every time, so thank you very much. Do we have any more questions? Olivia, doing the diploma at the moment and can't recommend enough. Thanks, Olivia. Are you doing the no sugar with Tim?
I didn't see you on the group, Siobhan.
I think you mentioned the other day.
Um,
Olivia watches her diet anyway. She always watches her diet. Trying to. It's
what's your
difficult.
plan?
That's the plan. Do we have any more questions there? You've got, where you can find him, Tim, on the social media. You're on Instagram, Facebook, LinkedIn, and you should have his QR code. And if you go to the Ikigai page, I've tagged Tim so you can follow him from there too. And
Thank
thank you
you.
very much, everybody. Thank you
Yeah,
so much, Tim.
thank you. It's a pleasure. Can I just leave one final message? Please
Yes,
consider when you're working clinically now about approaching the topic of sugar with your patients that are showing signs of inflammation. That'll be my one takeaway for today. Thank you very much. I really appreciate everybody giving up their time. Everybody's working clinically, and this is precious time.
it
So I really
really is.
appreciate you doing that in order to help your patients. That's really, really appreciated.
But thank you, Tim. And that's the best webinar I've seen in a long time. Very interesting,
Oh,
refreshing, someone addressing ultra-processed food. You have re-motivated me to eat better and talk differently to patients. Really interesting. Thank you so much. And thank you. I was so happy to listen to you and then go into my cardio class. I love that. Thank you.
thank you. Um, I'll stop sharing that now, and I'll disappear and leave you to your audience if you want.
Well, we're just going to say thank you. And Graham,
Okay,
this is Graham Brown, and he works for NSK. So he has just come on if just to introduce him. And if anybody has any questions, because people like to know who the engineer, we used to always have somebody on, Graham, and then they kind of left us to it. So thank you for coming on this evening.
My
So
pleasure.
it's nice to introduce Graham. And yeah, so let's end there. We're gone over time, but thank you for giving up the time. As Tim said, we'll definitely have you back sometime, Tim. And Happy New Year to you all.
yeah, happy
And
New Year.
next week, actually, we've got Kate Redding and Lisa Knowles, and they're called Perio Life Align. I don't know if you've heard of them, Tim. And they've introduced lifestyle medicine and positive psychology into their practice with the whole team. So they get a questionnaire to do with lifestyle. And we recorded a little podcast yesterday, and they're coming on next week. And
Cool.
they're in the middle of the journey. So it isn't perfect or anything like that yet, but they are so happy with the change of practice. They're now treating the patients, they're doing what they always wanted to do, they're coaching, and they're getting great feedback from the patients. So that's an interesting one next week for this
That'll be
audience.
good.
It's all connected. Yeah,
It's aligning with their value belief system. That what
absolutely.
and that you're happy if you're doing that.
Yeah.
Yeah,
And you can hear it when they're speaking, they're just so happy with their work.
yeah.
Yeah.
Bro.
So lots of changes and it's all good, isn't it?
Yes.
Yep. So take care and we'll end here and we'll see you all next week. Bye now.
Take care.
Bye bye.